As the number of COVID-19 infections continue to grow, so too, it seems, does the response from Armour Shield. The commissioning of this medical facility is the latest addition to the medical centre's efforts against the spread of the virus. In addition to its already standing PCR testing facility, Armour Shield is offering a high-end isolation centre in the Victoria Island area of Lagos.
Solidly entered the second wave, where we have a situation that demand now outstrips supply. Essentially, all the COVID caring centres are full. Certainly in the private sector, are all full. And at one point, over a short period of time, we had to turn away 20 patients because there was no capacity to take them on. So obviously, there is a need for us to increase capacity, certainly for this time. How long we're going to need this capacity, we don't really know. The original plan was to make this our sole centre. However, the current situation mandates that we keep both centres open.
Nigeria's commercial capital, Lagos, remains the epicentre of the outbreak of COVID-19 in the country. So it's no surprise to see the state governor, Babajide Sanwo-Olu, examining the facility while showing support of the effort to ramp up the response to a spread showing little signs of slowing anytime soon.
First, we need to appreciate who has put resources together, who had thought, because this certainly didn't happen within a week. Like you said, he's been building the capacity for the past 4 or 5 months, meaning that you need to prepare even when other people might think that it's not necessary. So you need to understand that capacity has to be developed. So people like that needs to be encouraged. Right, that's one, and it's a collaborative effort. We are doing our very best, but we need the private sector on board as well. It's only when both of us are on the same page that our people can get the service they want. That's second. The third thing is people also have choices, right? Whilst we have, our isolation center, we certainly need to give people that opportunity, that choice, of where they want to receive their treatment, and that's the kind of thing that is happening here. And finally, I think, as a governor too, I need to come and show from the point that I'm encouraging them, and I'm using this opportunity to tell other players in this industry that we're willing to support other hospitals, other medical centers that would want to pop up with a facility like this.
As questions continue to be raised over Nigeria's logistic preparedness for the vaccines rolled out across the world, one answer given is to focus on the task at hand, which for many is reaching the peak of this virus as soon as possible.
So this is a consequence of the fact that Africa as a whole is very weak in terms of research and development. And I think COVID, even though we've been advocating this for several decades, I think it's quite clear now that governments need not only to put increased resources into healthcare, but also into research and development, because we are at the beck and call of the countries that have that technology. So yes, if you are able to generate a vaccine, you're going to satisfy yourself first before you give excesses out to other countries. But there is a coalition across the world that is trying to ensure that there is fair equity and social justice in the distribution of vaccines, and that Africa, despite its lack of medical innovation and technology, gets a reasonable share of the technology. And of course, it's economically driven as well. So there is a scramble for vaccines, but as government, our responsibility is to regulate it, to ensure that not any vaccine comes in, to ensure that there are no rogue vaccines, no fake vaccines, and that those that do receive the vaccine are received in an ethically sound manner, and that we can follow these recipients of vaccines subsequently to monitor any possible side effects.
On tour of the facility, the medical equipment on display was an undeniable symbol of Armour Shield's medical artillery. From this MRI for the assessment of lungs during a patient's infection, to the laboratory allowing tests to be done on site, and this 4-bed intensive care unit equipped with ventilators and other life-saving equipment, queries over cost are inevitable. The 17 to 20 bed facility was financed through a loan with Access Bank. The amount has not yet been publicly disclosed, but for a private facility, it's expected that costs will be recouped from patient medical fees. The very nature of this virus means that infected patients must be kept away from their loved ones while isolating. But the Armored Shield facility allows patients to have visitors who can get as close as this glass barrier allows. Another modern solution to the tackling of a novel virus that caught the world unawares. Well, the latest part of the Armored Shield Medical Centre's arsenal against COVID-19 is represented by this building. And as the tide from Nigeria's second wave of infections grows even larger, medical professionals here say they're dedicated to making sure their patients won't be swept away. Adefemi Akinsanya, Arise News, Lagos.